feel like I'm living in a big black hole. Feel like when I'm depressed, I feel like it's like I'm locked up inside myself and I can't get out.
It's dark. And it's actually painful. And it's tiring. And it's one of those things that death would almost be, it has got to be a better feeling type feeling, and it's ongoing. Even in the midst of the best of things, it's still there.
It's pretty miserable. It's not a pleasant feeling. Pretty much you feel alone all the time, even if you're in a group of people. Despair, I guess, would be the biggest thing, is that you feel alone, you're worthless, you have no friends, you have no life, there's no reason to be here, and you just don't want to be around anything, and you lose the will to live.
I've attempted to kill myself 4 times, and the first time was with hanging. That didn't work out, and the second and the third times and the fourth times were with overdosing, and I didn't and the second and the third time I didn't get any medical help. I just I felt really horrible for a couple days. I was really sick, for having overdosed. I made myself very sick, and but the fourth time was the last time, and that was back in '96, and I landed in the hospital because of that.
Yeah, this pain has been so bad sometimes that I just, like I said, I don't want to live. One time I was going to take a whole bottle of pills to do away with myself. Another time I tried to take a razor and I was going to cut myself. I wanted to die.
I did try suicide. I took some sleeping pills, and I took a lot of sleeping pills, and they weren't working as I thought they would. They were causing paralysis instead of sleep. So then I wound up calling 911.
The thoughts of I wish I were dead, and many times go to bed and pray, God, please take my life. I don't want to live in this world anymore, and just try to feel yourself dying, try to feel like you're going to drift off, and then waking up in the morning and being mad because you're still here and you're still alive and you didn't die.
Depression is one of the most common psychological conditions affecting over 17 million American adults a year. Studies show that approximately 15% of the population will experience clinical depression at some time in their lives. If left untreated, clinical depression can lead to self-destructive behaviors such as drug and alcohol abuse, and in many cases, suicide. According to the National Center for Suicide Statistics, every 42 seconds, someone attempts suicide. Every 17 minutes, someone dies by suicide, making it the 8th leading cause of death in the United States. In 1998, Kane County recorded 47 deaths due to suicide, compared to 25 deaths due to homicide. The suicide rate among young people ages 10 to 14 continues to rise dramatically every year. For young people ages 15 to 24, suicide is the 3rd leading cause of death. The suicide rate increases greatly for persons 65 and older. For older adults, depression can often be attributed to the presence of social isolation or physical illness. clinical depression is not part of normal aging. But as alarming as these statistics are, there is good news. Depression is among the most treatable of psychiatric illnesses. Estimates suggest that 80 to 90% of people with depression respond positively to treatment. And 30-year longitudinal studies from the U.S., corroborated by European studies, have shown that complete recovery is possible. Unfortunately, depression is often misdiagnosed because many of its symptoms mimic the symptoms of other physical illnesses. These symptoms include loss of energy, sleep disturbances, appetite problems, chronic pain in joints and muscles, headaches, stomach aches, and backaches. Individuals with symptoms of depression will often seek help from their primary care physician rather than a mental health service provider. This makes it critically important that the physician be able to quickly differentiate between symptoms of depression and symptoms that are the result of other physical illnesses. The purpose of this program is to increase physician awareness of the importance of early detection of depression in the prevention of suicide.
Report after report in the literature stresses the large percentage of individuals who present at primary care and specialist offices with complaints, often vague and multiple ones, that are directly attributable to the effects of stress, anxiety, and depression. Often it's only after patients have undergone exhaustive medical assessments that they come to me with the question of whether psychological or psychiatric factors may be involved in their presentation.
I've gone to doctors and with headaches, severe headaches, and the doctor would prescribe medication. I've been on Darvocets and stuff, and the pain still didn't go away. They said that must be stress.
I was concerned about my smoking and drinking and sex life, and I was worried that my thoughts were getting out of control, and I went and saw the doctor, and he put it down to just normal college male behavior, and he said, you know, we all go through changes, and you know, these things, these are not, you know, abnormal things. He didn't find that it, you know, that I had any kind of psychological problems.
I would have horrible fatigue. I would have horrible pains in my stomach. Like I said, I went through more upper GIs, more ultrasounds, lower GIs where nothing was founded. I mean, my senior year of high school, my doctor, the only solution she had for me at the time was to just drink a lot of Maalox, because no ulcers were actually found, but that was the only preventative thing. It just costs a lot of money to have tests come out unfounded, and I still don't know why a lot of things were the way they were.
Far too frequently, I'll see an individual in a consultation after an overdose or another self-destructive action who in retrospect has been clinically depressed for a significant time period. Studies clearly indicate that a large percentage of the individuals who have ultimately committed suicide had been seen by their personal physician within 1 month of the suicide.
It's important to recognize that pain and other organic diseases are strongly associated with depression. In fact, depression as a primary process can lead to real pain and real organic disease, either as a direct consequence or as the result of iatrogenic complications of treatment. It is also well understood that non-recognition and/or undertreatment of pain and the associated depression are recognized risk factors for suicide. Consequently, it is vital that we must both suspect and even assume depression in situations of chronic pain and long-term illness, even when the presenting affect is anxiety, anger, or even a covering of bluff good humor.
Over recent years, significant advances have been made in the understanding and treatment of depression. However, the stigma of mental illness continues to influence physician and patient attitudes. This stigma, along with additional factors, often impedes the diagnosis and treatment of depression.
Despite the advances in brain research, which convincingly demonstrate the physical nature of major affective illness, there remains a reluctance for many patients to acknowledge depression symptoms to others, including their physicians, or to seek treatment. Stereotypes which continue to prevail include the sense that depressive illness occurs in morally or emotionally weak or in lazy individuals. Because of this stigma, patients may be vague about their symptoms or focus on those symptoms which they feel to be physical, such as a loss of appetite or the development of a sleep disturbance, pain, or fatigue. The physician is in a very important place to model for the patient the acceptance of the bona fide nature of depressive illness by actively asking about it, screening for it, and initiating or recommending treatment when it is diagnosed.
Diagnosing depression may be difficult for many reasons. First, we have no commercially available x-rays, blood tests, or scans which can identify depression. Secondly, as people's moods and feelings normally fluctuate, the border may be blurred between these normal variations and depression. It certainly would be easier if the symptoms of depression affected everyone in the same way, but they don't. While depression generally includes changes in things like memory, concentration, mood, sleep, and so on, women may be more prone to tearfulness, whereas men may display anger. Furthermore, it is often difficult to get people to accept this diagnosis because they associate depression with mental illness. And they don't understand that depression is a biochemical imbalance, much like diabetes or high blood pressure.
The first step to getting appropriate treatment for depression is for the individual to undergo a thorough physical examination. This will help rule out a physical cause for the depression, such as the effects of medication, infection, anemia, endocrinological or hormonal factors, or other influences. The patient should then be asked to complete a depression screening questionnaire. Screening is a simple but important tool that can help identify individuals with symptoms of depression. Routine screening can also identify individuals who may be in the early stages of depression. This allows for treatment before the illness becomes too severe. The hand screening tool was developed to help quickly and accurately identify patients experiencing depression in the context of a routine office visit. This self-rating questionnaire was designed by the Harvard Department of Psychiatry and the National Depression Screening Day Project. It addresses how likely the individual is experiencing depression, ranging from not likely to very likely. The hand screening tool is based on criteria for a major depressive episode set forth in the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. The questionnaire consists of 10 questions that ask the individual to rate how often each symptom has been present over the previous 2 weeks. After the individual answers each of the questions, the total score is calculated by adding the points together. If a patient's score suggests that they are experiencing a depressive disorder, the physician can then advise the patient where to find the proper treatment. Often this begins with a referral to a qualified mental health care provider for further evaluation.
Who do you screen? It might be suggested to screen all new patients to your practice, to rescreen at the time of updated physical examinations, to screen any patients who are known to be under significant stress, those with multiple, vague, or ill-defined somatic presentations, as well as those patients who are being treated for depression in order to monitor their response to the treatment.
The doctor I went and seen, I didn't go to him for, I went to him because of all the symptoms I had, the aches, the pains, the being tired, the headaches, and this doctor that I went to, he asked me more personal questions. And he didn't run me through a battery of tests. He says, I think you're suffering from depression, and he gave me some medication for that, and that was the start on my recovery from depression.
When I went to my doctor about depression, there were really no physical ailments that she could treat. It was more like lots of flu symptoms and things like that. And I was so emotional, and everything. She said that she felt that I was depressed.
I think that the first doctor that I saw would have been more effective if he would have looked at my concerns from a clinical angle. Like if he would have taken what I had to say and applied some kind of measurement or something to see if if I was suffering from depression or from some psychological problem.
You know, the mind is a powerful thing, and the mind can make the body do many things. And I think if you not only look at the symptoms a person comes in with, but you look at their mental state, that would have a lot, one, it'd make their job easier, and two, it could save lives.
Screening is a simple and effective method for identifying patients experiencing clinical depression. Earlier diagnosis and treatment not only helps patients to improve the quality of their lives sooner, but it can also save lives.
Depressive illness kills. Statistics show, and our own experiences reinforce, that depression and suicide represent major and increasing health concerns in our society. Screening is an essential component in reducing the all-too-real morbidity and mortality associated with depressive illness.
Studies have shown that as many as 1 in 5 people may experience depression, with this number being substantially higher in patients with chronic illnesses. Unless we actively screen for depression, many of these individuals may not be diagnosed or appropriately treated. However, through the use of screening, we as physicians can help these individuals to begin the process of recovery.
The Illinois Project for Local Assessment of Needs, or IPLAN, was established for 2 main purposes. First, for communities to identify and prioritize their health problems, and second, for communities to develop a 5-year plan recommending solutions for these problems. The community identified depression and suicide as one of the main health risks facing Kane County. A survey conducted of local physicians found that less than 1% currently offer standardized depression screening. So one of our objectives became to increase the number of physicians who are trained to screen patients for mental health problems and make referrals. The Suicide and Depression Prevention Task Force was formed to implement programs recommended in the plan. And to do that, the task force has embarked on general suicide education and public awareness campaign utilizing the HANDS depression screening tool. We have also put together a list of mental health resources for non-funded patients to assist physicians in the referral of their patients.
Studies have shown that early detection and proper treatment of depression decreases the incidence of suicide. By using routine depression screening in their practices, primary care and specialist physicians can convey hope and provide help to individuals experiencing depression at a critical time in their lives.